Hi everybody, welcome to a very interesting video on the human skull. I am Dr. Ankit, Professor of Anatomy, and welcome to our YouTube channel Human Anatomy by Dr. Ankit. So in this video we are going to look at the deeper lying facial bones which forms the nasal septum, the lateral wall of the nose and other important bones. Let's start. So the blue highlighted bone over here, as we all know, is the frontal bone, and these are the paired maxilla which forms the or which lodges the upper jaw teeth. Now, if we start to remove these superficial bones, then we will start to look at the deeper bones over here. So let us remove the right maxilla first of all, and then let us remove the left maxilla. Okay. Now let us see the bones over here. If I slightly enlarge it, okay, now this bone over here are the paired nasal bones. Okay, that you can very well see. Now we have removed the maxilla. This bone over here, which is lying behind the maxilla and forms the medial wall of the orbit, it is a lacrimal bone. And behind the lacrimal, we have this as the sphenoid bone. Same on the left side, we have this as the lacrimal bone and this as the sphenoid, the ethmoid bone, right? The sphenoid is the other, I'll show you later. So now let us remove these bones as well. So let us first of all remove the right lacrimal bone, and then we can remove the left lacrimal bone as well. And let us remove these two nasal bones as well. Okay, fine. Now what we are seeing, this is the all ethmoid bone, right? It is lodging the ethmoid air sinuses. Now this bone over here is the perpendicular plate of the ethmoid bone, which is forming the upper part of the nasal septum. So this is a part of ethmoid bone only. So these are the ethmoid bone which are having the ethmoid air sinuses, which are also forming the superior and the middle nasal concha. As we all should be knowing that the inferior nasal concha is a separate bone, and here is the inferior nasal concha on the right side and inferior nasal concha on the left side. So these nasal concha, they form the lateral wall of the nose or nasal cavity. So these are the lateral wall of the nasal cavity, and this perpendicular plate of the ethmoid is the medial, or you can say the nasal septum. Now let us remove them, or let us remove the inferior nasal concha on the right side, and let us remove the inferior nasal concha on the left side. Okay, now you can see this is the perpendicular plate of the ethmoid. Now which bone is this, which is just below the perpendicular plate of ethmoid and forms the lower part of the nasal septum? This is our very own unpaired the bone, that is the vomer bone, right? So this is the vomer bone. Okay, now let me show you at this particular point of time two other bones. What are those? One is sphenoid and one is the palatine bone. So let us see. Now we have removed the maxilla. As we all know that maxilla forms the anterior major part of the hard palate. Now if you look over here, then can you recognize this bone? This is the right side palatine bone, which is forming the posterior part of the hard palate, and this is the left side palatine bone. You can see the perpendicular plate of palatine, the horizontal plate of palatine, and the palatine processes over here. So this is the palatine bone on the left side, that is the palatine bone on the right side. They are just behind the maxilla. Fine. Now this is one palatine we have seen. Now let us see the sphenoid bone as well. Look at the sphenoid. Let me remove the frontal bone over here. So let me remove the frontal bone like this. Now as we have removed the frontal bone, now we are looking at inside the cranial cavity. Sphenoid bone, we should be knowing, is an unpaired bone over here. So this is the complete sphenoid bone. Look at the butterfly shaped, such a beautiful sphenoid bone, having a paired the greater wing, paired lesser wing, having a body of the sphenoid, just having sella turcica, which houses the pituitary gland and all that. This beautiful sphenoid bone, and just in front of sphenoid, this over here is our ethmoid bone, having the ethmoid cribriform plates over here, and this is all complete ethmoid bone. Ethmoid bone, let me tell you, this is the complete ethmoid bone. Let me enlarge it. This is sphenoid, that is ethmoid. What is this? This is the cribriform plate of ethmoid. This is the cribriform plate of ethmoid, right? You know it lies where? It lies at the roof of the nasal cavity. Let me remove the cribriform plate of ethmoid, or let us just keep it for a while, and then let us see what else removes. The whole ethmoid bone is now removed. Okay, so what is left now? This is the vomer bone. Okay, and if we just revise a bit, this was our left and the right palatine bone. So let us remove the vomer bone as well. Look how it is articulating with the sphenoid bone posteriorly. So this is the sphenoid bone, this is the vomer bone. Okay, let us remove the vomer bone for a second. We have removed the vomer bone. Okay, so normally we have removed majority of all the bones which are forming the nasal septum and the lateral wall of the nose. Okay, let us remove this palatine bone as well on the right side as well as on the left side. So what are we left with now? We are left with this entire sphenoid bone. We are left with the entire sphenoid bone. Okay, so that's all, guys. And on the side we can see this is zygomatic bone. So just to revise it, okay, keep on looking at the video multiple times. You will have a good understanding. You will get a good 3D idea of where are the actual bones, where are they articulating with. I hope you like the video. If you like, just click on the like button, share it with your friends, and don't forget to subscribe to our YouTube channel. Thank you. Bye bye. Till next interesting video.